Hello, everyone. When you hear the terms conventional medicine, allopathic medicine, Western medicine, functional medicine, integrative medicine, do you get a little glary-eyed? Or maybe you wonder what the treatment terms such as holistic, integrative, alternative, and natural mean. You're not alone. That's why I want to provide clarity around all that. If you suffer from chronic health problems, I want to help you understand so you can make wise healthcare decisions. Hi, I'm Kelly Wilhite, holistic health practitioner and coach, and I help folks have freedom from suffering and relief from chronic symptoms. I'm going to try to make this as simple as possible, though it can be complex at times. If you have any questions, please feel free to post them. I love to educate and empower, as I desire for you to have the best informed, or for you to be best informed so you can make wise decisions when you're seeking a doctor or practitioner, and wise choices on the kind of treatment or therapy that is best for you. When it comes to types of doctors and practitioners, typically those that seek to diagnose and treat symptoms fall under the umbrella of practicing conventional Western, traditional, mainstream, or allopathic medicine. At least it usually falls in one of those terms. Those are the most prevalent terms used. I absolutely respect them as experts, as what they are taught in medical school, and that is diagnosing based on specific test results or band of symptoms. Now, once a diagnosis occurs, and even if there hasn't been, but there's a clear symptom, treatment usually centers around management of the symptoms through pharmaceuticals or surgery. For most acute problems, that's fantastic. We need that. If I'm in an accident, I have broken bones, a collapsed lung, I want to have an ER to go to where I get care for my acute problems. So heck yeah, those practitioners and kinds of treatments are very necessary. However, unfortunately, that kind of help fails those who have chronic conditions. Why? Because it fails to dig deep and uncover the underlying reasons why the symptoms are happening in the first place, and then address those root causes. Conventional medicine is disease management, surface layer, and segmented, rather than working with someone to address them as a whole. All the functions and processes within us are interconnected. Our parts do not function in isolation. What happens in one area of our body, or a symptom that manifests, for instance, in our head, can have at its root and be triggered from a completely different area of our body. The CDC says that 6 out of 10 Americans have at least one chronic illness. That's a lot of people. The prevalence of chronic conditions continues to rise. It's now the leading cause of death and disability in the US. We have rising costs in healthcare for a system that is not fixing the problem, and in many cases making it worse. Okay, I don't want to go down that path, so let's go ahead and stick with and talk about the solution. So in trying to keep it simple, we talked about conventional medicine practicing in a way that treats symptoms. Besides prevention, which is a whole other topic, the better way to deal with your chronic health issues is through the concept of functional medicine. Functional medicine looks at a person as a whole. The focus is to view a person from all internal factors, what's going on in the body everywhere, and external factors, lifestyle elements, toxin exposure, stress management, social and spiritual life, and all the external things that impact our wellness. We need to peel the layers of the onion back to really get to the underlying root causes of what's going on in our body. And typically it is a combination of things. There's no magic fix, but it is worth it. It is a process. It takes time, but with diligence and commitment, having your healthy life back is priceless. I know I went from nearly being bedridden to have the quality of life that I have now. So when I say I help folks have freedom from their relentless symptoms, this is regardless whether someone has a diagnosis or not. We don't chase diagnosis or symptoms. We help uncover why things are happening the way they are and address those factors. This can be complex, and it does not happen overnight. It is why having an expert like me to help you with setting goals, staying on target to meet them, guiding you, and even holding your hand, so to speak, to now help you navigate along your health journey is so important to your success. I mentioned before that traditional medicine typically uses pharmaceuticals and surgery to manage chronic disease, and even that is failing many miserably. Many times those things actually create more health problems, and people definitely become more and more frustrated. With functional medicine, the approach is typically holistic and natural, meaning areas relating to nutrition, proper hydration, resolving nutritional deficiencies, and many people have more than they think, creating and implementing healthy lifestyle habits like sleep and activity, stress management, reducing toxic exposures, and so much more, and doing things to support the body's ability to heal. Of course, there are so many other holistic modalities that are part of this, such as chiropractic, acupuncture, meditation, and many more that can be very, very useful. Our bodies have an innate nature to heal, but we are so bombarded with negative influences, both intentional, like poor dietary habits, lack of quality sleep, not managing stress, and a negative mindset, not creating good self-care habits, or even unintentional or uncontrollable factors like air and technology pollution, infections, and more. Eventually, our body functions give out. So through holistic and natural care, we give our bodies what they need to function as optimally as possible as we remove the irritants and obstacles. I do want to make something very clear. I am not against pharmaceuticals when they are appropriately administered and used. However, they're not the ongoing answer as a long-term best solution to chronic health problems. Here's an example. A condition may start out as acute, but the trigger may be based on a chronic issue. What I mean by that is you may have a severe asthma attack that must be managed with acute conventional care such as steroids or even a trip to the hospital. However, your asthma has been persistent, so when you're stabilized, rather than just continuing to manage your symptoms with steroids, seeking and addressing the root causes may keep you from having severe asthma attacks in the future. So sometimes pharmaceuticals are necessary as a triage approach, meaning to stabilize someone from a severe acute reaction or situation. The timing and extent of this depends on the situation, of course. The ultimate goal, however, is not to need pharmaceuticals to sustain a chronic condition, which continues to treat the symptom, but to provide the body what it needs to function well without it. Is this 100% possible in 100% of every situation? Look, I'm realistic, maybe not. However, in most cases, it is possible, especially when intervention occurs before it becomes too late. At the very least, many have significantly reduced their need for pharmaceuticals as their body functions better from holistic and natural care. I certainly hope this has answered some of your questions. And in summary, conventional or traditional medicine is based on diagnosis and treating symptoms using pharmaceuticals and surgery. And functional medicine views a person in their entirety, uncovering and addressing root causes and helping our bodies through holistic and natural solutions that allow and encourage our body to function well and the way it was created to. Thank you for listening. I really appreciate it. As always, I encourage you to ask questions. And until next time, God bless you and enjoy the rest of your day.